everyone. Hope you've been staying safe and healthy, and thanks for checking out my vlog, A Dose of Reason. I'm Dr. Shira Doron, an infectious disease physician and the hospital epidemiologist at Tufts Medical Center in Boston. Every week, I look forward to answering your questions about the COVID-19 pandemic and sharing my thoughts on the latest news and scientific updates and breakthroughs so you can make the best health and safety decisions for you and your family. You can send me your questions to adoseofreason@tuftsmedicalcenter.org. Please include your first name and hometown with your question. I'll pick a few questions each week to discuss in the vlog. It's been another week of good-ish news. Good-ish because cases continue to drop, hospitalizations are starting to come down here in Massachusetts, and our wastewater viral levels are still really plummeting. But cases and wastewater viral levels are still higher than they were in prior surges. So there's a lot of infected people out there in Massachusetts. Hospitalizations are high, not as high as the first surge, and the new mass hospitalization metric designed to try to parse out who is hospitalized with COVID versus for COVID is somewhat reassuring. The new reporting mechanism has hospitals check each patient who's COVID positive and in the hospital to see whether they've received the drug dexamethasone, which is the standard of care for people with severe COVID with lung involvement. So it's not exactly a measure of who's in the hospital due to COVID, but it's a good proxy. And the data show that about half of patients have not received the drug dexamethasone. That's good and bad. It's good because it means that here in highly vaccinated Massachusetts, a lot of the COVID patients in the hospital aren't actually that sick with COVID. But it's bad because it means that when the Omicron wave is over, we aren't going to get back as much hospital capacity as we may have thought. Our first question comes from Marie from Boston. I initially received a single J&J vaccine, but after hearing the blood clotting issues and risk of Guillain-Barré syndrome, I'm fearful of getting a J&J booster. Have there been sufficient studies on how safe it is to get a Moderna booster in my situation? I thought the WHO had recommended that vaccines not be mixed. Well, Marie, it's very safe for you to get a booster with a single dose of Pfizer or Moderna, as long as it has been 2 months since your dose of J&J. It appears to be both safer and more effective to go with one of those two brands than another dose of J&J for the very reasons you mentioned, the risk of blood clots and Guillain-Barré. Neither of those side effects are a concern with Pfizer or Moderna, which is why the CDC recently recommended that patients be counseled to choose Pfizer or Moderna over J&J for the initial shot and the booster. Our second question is from Susan from Pepperell. Many appointments and tests important for diagnosis and treatment have been delayed significantly because of the extreme number of COVID cases. What is needed in terms of COVID numbers to get those appointments, tests, procedures rescheduled? Susan, to make sure that no one hospital's patients are being denied care more than another's, the state has rules about when and whether elective surgery can be performed. Hospitals have to have a certain percent of their beds available for new admissions, or they must cancel surgeries that are likely to result in a hospital admission. In some cases, additional services like outpatient surgery and other visits may need to be canceled because of the critical staffing shortage that hospitals are facing. There really isn't a COVID number threshold because it's not just about COVID patients. Even before the Omicron wave, hospitals were struggling. It's COVID patients, but it's also the loss of healthcare workers from the workforce, and it's the fact that people are just generally a lot sicker, presumably for a variety of pandemic-related, but not necessarily COVID-related reasons. Over the past few weeks, hospitals have had huge numbers of workers out sick with COVID. The state recently allowed those workers who test positive for COVID to come back after 5 days instead of 10, and that's helping. Between that and the falling case rate, I hope we'll be back to full function soon. Our last question is from Eileen from Needham. When is it safe to resume marital relations with a spouse who tested positive for COVID-19? I read after 14 days, is that still the case? And I also read that the virus can show up in semen for up to 3 months. Is that true? And if so, a reason for concern? Well, Isolation after COVID has technically been shortened by the CDC and the Massachusetts Department of Public Health from 10 days to 5 days, but with an additional 5 days of meticulous mask wearing. Since you can't reliably wear a mask when you're sleeping, I suggest sleeping in separate rooms for the full 10 days. Though I personally would allow my spouse out of strict isolation after 5 days if he were wearing a good quality mask in the house, but not for sleeping in the same room. While viral particles can be found in semen and in feces after full recovery, it's not believed that the infection can be transmitted via either of those bodily substances. That's all the time we have for this week. You can send me your questions about the Omicron surge, booster shots, COVID testing, or anything else related to the pandemic or infectious diseases to adoseofreason@tuftsmedicalcenter.org. I look forward to dishing out a dose of reason to you again next week.